Shall we start? I'm Mike Lane. I'm the past chair of the Tompkins County Legislature. I am continuing as a legislator from the east part of the town of Dryden. I currently chair the not only the Facilities and Infrastructure Committee for the county, but also the Complete Count Census Committee. We're so pleased to have everyone joining us for this town hall. It's something that we've had a lot of interest in, and we've got a couple of special guests today. Dr. Jeff Madison, who's the superintendent of TST BOCES, and Dr. Lavelle Brown, who's the superintendent of the Ithaca City School District. And they will be answering some questions and sharing reactions to the state's release of the K-12 schools reopening guidance. We've seen a concerning rise in the positive COVID cases over the last week. With 10 new cases being announced yesterday alone, we're back up to 17 active cases. Our community has done a very good job of stemming the spread of COVID-19. But as we've seen, there's been an uptick in the past week due to individuals not following guidance. And it's so important that people follow guidance. It's important that you continue to wear masks, keep distance from one another, and not gather in dense situations. So we must keep those things in mind as we move along this afternoon. Something else that I'd like to encourage all citizens to do is take the 2020 census. COVID-19 has negatively impacted our community in many ways, and we will need all of the resources due to Tompkins County. For resources, read grant funding in order to recover from this crisis. The U.S. Census is critical to counting the local population and ensuring that correct resources are afforded to us here. These resources support our communities, funding transportation infrastructure, give valuable data to businesses and nonprofits, our schools, and help finance robust social services services to be available. We have a lower than normal response rate so far to the 2020 census due to the pandemic and to the fact that we have a lot of students that went home early this year. And we still have time to ensure that everyone gets counted. If you've already completed the census, please reach out to your neighbors, friends, and family and encourage them to do so as well. I would encourage everyone to set a goal of making 10 or more people if they've completed their, asking 10 or more people if they've completed their census report. Dominic Recchio will post more information in the chat box on how to complete the census and what to share with others in encouragement. At this point, I'd like to introduce our Public Health Commissioner, Frank Krupa, and he's going to continue this afternoon and bring us up to date on some of the issues having to do with COVID. Frank?
Thanks, Mike. I appreciate the introduction. Unfortunately, I am the bearer of bad news this evening. We will be reporting an additional 7 positive cases today. So we continue to see an increase in cases here in Tompkins County, and these new cases, most of which are related to travel to highly impacted states in the United States. So it is important, your reminder about continuing to follow guidance and recommendations. We've discouraged travel to these affected states throughout the country because we know the chance of bringing it back does increase risk here in Tompkins County. Just as importantly, the ideas of density, the social distancing, staying 6 feet apart, wearing a mask, and good hand hygiene are still the core foundation of what we're asking our community to do, and those are extremely important for us. So while we are certainly concerned about these recent spike in cases, we're on top of it. We are doing case investigations immediately and isolating and then quarantining close contacts. So we just ask our community to continue to be vigilant and help us contain the spread here in Tompkins County. You also mentioned guidance being released for K through 12, and we have the good doctors here to talk to us a bit more about that. The state education department, as well as the Department of Health, has put out a framework. We are expecting a bit more guidance in the next day or so to help guide those conversations. But they did also leave quite a bit of opportunity for local districts to make decisions about how they're going to operate in the fall, with the governor and the state ultimately maintaining the responsibility for deciding about school openings sometime in early August. So we appreciate the collaborative nature in which all of our local school districts are working together to learn from each other, as well as try to create uniformity wherever it's practical, so that it's clear for our community how we're going to move forward from a K through 12 perspective. So with that, I'd like to turn it over to Dr. Madison to talk a little bit about K through 12 from his perspective.
Well, good afternoon, everyone. And really, we are in a very fluid situation like we have been since March 13th. The guidance is coming gradually to us. We received some pretty clear guidance from the Department of Health on Monday, and the State Education Department had published that framework of what the considerations are for reopening. They're busily right now working on a document to integrate all of that information and the regulatory framework that they adopted on Monday to give us clearer guidance. And what will happen from here is a portal will open up at the state for each school district and BOCES to submit a plan for reopening in the fall. And those plans will be due by the 31st of July. And there'll be some specific items that have to be in there. Many of them are covered in some of your questions, so it'll be good to get to those when we get to those. But we're going to be working within the guidance. We do have some leeway, and I will say that the superintendents of our districts have been in pretty good communication. When they get on a call together, they talk about things that they can do in common. There's a local flavor to every reopening plan. And we just need to understand that there may be some things that are some expectations and abilities that districts are able to do within their framework and their contracts and their local community that maybe a neighboring community may not be able to pull off. And we need to be patient with that and try to be good community members to assist every district to do our best to get all students back and get the best education that we can deliver in the fall. There's no one who is planning on not having any students back in the fall, and that's the good news. What that exactly looks like as an educational experience is still up in the air, and people are busily working on those plans.
Dr. Brown?
Yes, thank you for the opportunity, Frank. It truly is an honor to be here. I wish to start with a thank you. I remember that press conference on March 13th, and we said then our behaviors in these coming months will dictate whether or not we can reopen our schools. And fortunately, we're in a situation in our local community where we have done our best to mitigate the spread of this deadly disease. And we're in a situation where we look like we can open our schools as of today. That's exciting. Our educators are excited about it. Our teachers have been outstanding throughout this process, continuing to educate our young people. Our families have been outstanding in being patient and flexible as we have been continuing our instruction and now planning for multiple scenarios, not knowing exactly what will happen. I will say we plan to have all of our young people return according to our academic calendar, which is in September, knowing that much can change between now and then, but we are heading towards opening up in a very safe way, according to the guidelines, but we are eager to get our young people back into our spaces, our community, back to learning in the ways in which we do best, and that's in person, but also at the same time prepared to offer a virtual experience for those families who choose and need that. And I foresee, and I know we'll talk about this later, I foresee that multiple opportunity and that family choice being the way we will be operating for the foreseeable future.
Great. And so I guess we'll jump over to questions now, and we start by introducing Amy Hendricks, Deputy County Administrator. She's our MC, and she'll navigate us through the questions.
All right. Thank you, Frank, and thank you all for joining us tonight. we'll go ahead and get started with the questions. And if people have additional questions, you can go ahead and put them in the chat box, and we'll be sure to ask them of our panelists this evening. So I'm actually going to start off with Dr. Brown and Dr. Madison, a little bit about knowing the controls. So what are the controls for knowing when or if schools would have to be shut down again? So once we open, what would that look like? Is there a community-wide infection rate that would trigger that? Or is there something else that would be shutting the schools back down?
Dr.
Well,
Madison.
if you want me to start, Dr. Brown, I'm happy to. Well,
Go
first,
for
there is a metric for reopening that we need to keep our eyes on, and that is as long as our infection rate stays below 5% on a 14-day rolling average, we're slated to reopen. We're well under that right now, and hopefully these infections won't continue to climb. But we got to remember that we're part of the entire Southern Tiers metric. It's not going to be a local metric for us. And the closure number is a 7-day rolling average of 9%. So if at any point as we reopen, it hits that metric, then we're going to be closed down. So that's looking at a district. But there's also a different way of looking at it. We will also have to put in our plans how we're going to close an individual classroom or an individual school building. So there's going to be more flexibility than we had in the spring, where it was all open or all closed. And we will have to, working with the Department of Health, determine the metrics for how to close a classroom or a building, or then even the district, depending if we have an outbreak in a particular place. And so there'll be constant communication on that, and a little more loose metrics, because it'll depend on the situation and the students involved and the adults involved. But there will be a requirement in the plan for us to account for that.
Sounds like a snow day, Jeff. When we have some flexibility, and every district may be doing something different, and some communities may need something different on that given day. So yeah.
Right, thank you both. Dr. Brown, can you explain what a hybrid learning model looks like? There's a lot of discussion about these hybrid models. What does that look like to you?
Oh, every community may have a different definition of that. When I think of a hybrid approach, I'm thinking about an approach where young people are in person for a day or a portion of the day, and then are also receiving instruction in a digital environment as well. Some refer to that as a blended environment. Some refer to that as a hybrid environment, but it's a combination of the traditional in-person approaches and a blended virtual approach as well. And so for us, when we're talking about it, it would be that if we are in a situation where young people are coming on alternating schedule and they're receiving instruction in a digital environment when not in school, that would be our definition of a blended or a hybrid approach.
All right, thank you. Dr. Madison, what are your biggest concerns and what challenges do you foresee as we move forward with the districts developing reopening plans along in the state's guidelines?
Yeah, well, in the interest of time, I'll keep this brief because that's a big question. But obviously, our number one concern is the health and safety of our students and our employees. And so that's number one as we do our planning, is how we're going to keep people safe, how we're going to keep people informed, while we try to execute a positive educational experience for everyone this fall. Number one concern on top of that is really, how are we going to staff these models? Are our people going to be available? We have childcare issues for our adults who need to come to work for us. And depending on the school districts that our employees live in, if they're on a model where there's some in person, some at home, we may have people who are unavailable on certain days. And we may have to do that hybrid or blended approach where a person may have to pipe into the classroom. We have another person who's responsible for supervising a classroom. We could have the same experience happen where a student has to remain home for a short period of time and have to pipe into a classroom. So those are very big deals. Having personnel to supervise the students in the middle of a pandemic is going to be a challenge, because people do get sick. They regularly get sick. Just as a matter of course, in living our lives, we have ups and downs. We have things happen to us, and we have things happen to family members. We want to be compassionate, but we also need to find a way to meet the needs of the students in front of us. So my biggest concern is how we staff whatever model we have. But number one is the health and safety. And probably the third one I would say that's the biggest challenge for us is social distancing on the campus in our classrooms and on our transportation, and figuring those items out in a way that makes everyone comfortable and feel safe so that we're able to be focused on the education of the students is going to be the trick for us.
I mean, can I add, yeah, transportation is going to be a huge barrier for us all and a challenge for us all. We were already having issues finding enough bus drivers before. And I can see that being even harder now in the coming months. So I would add that. And then, you know, there's no place in these reopening plans that we're developing that speaks to what happens outside of our schools and in the community. I'm concerned that no matter how much we plan and how much we think about what it will look like for young people to be back in our spaces or not, we can't control what people do at Target and Lowe's and at parties on July the 4th. So as a community, if the things we do today will make a determination about whether or not we can have our young people back in schools in September.
Thank you for that. I'm going to shift over to Frank for a minute and put him in the hot seat. Frank, this is about mask wearing. Many stores aren't enforcing mask wearing. Are masks a New York State requirement? And what should someone do if they see someone not wearing a mask?
So that's a really good question, Amy. And this week, the state added some more strength to the mask wearing requirements, particularly for businesses. They are now mandated to deny entry and or remove from their businesses anyone not wearing a mask. And so we have been communicating over the last day with local businesses, providing that guidance to them and helping them understand what their responsibilities are. So we're hoping that in businesses indoors where there's more potential for exposure, at least we'll see some more compliance with mask wearing. Although I must say, I think mask wearing has been going fairly well in our community. It's not perfect by any means, but we should take some credit for having accepted and adapted to the guidance. The question about what folks should do if they see someone without a mask, the first thing is really, we've talked about personal responsibility from the beginning. You control how close you get to any other person in almost every instance. So if someone is not wearing a mask, it's about the potential exposure to you, why we're so concerned. So keep a distance, right? Going up to that person to confront them about not wearing a mask is probably the last thing you want to do because you're putting yourself too close. So, you know, I would recommend folks, if they feel the need, to talk to an employee at the store or a manager to make them aware, so that way they can implement their plans for addressing the issue. There is always the state hotline for complaints that folks can put those into if they feel necessary, and those get funneled back to our environmental health division for follow-up.
Frank, a little more on the mask wearing. As you said, it's a business's responsibility to help enforce this. What should a business do if a shopper claims to have a medical reason for not tolerating a face covering? Is that person allowed to enter the store, or can the business prevent the person from entering the shop by offering a service such as curbside delivery or working with the individual?
I think it's both of those. I mean, I think offering alternative solutions, I would suggest if someone has an underlying health condition that makes it difficult for them to wear a mask, they're probably in our vulnerable populations related to exposure. And if we could find a way to provide them the same service without them needing to be exposed, you know, within the store, that's a win-win all the way around. But ultimately, there is an exemption for children under 2 and those that are not medically able to tolerate a mask. And I know there's a lot of question about what does it mean to be medically not be able to tolerate a mask. And there is no finite answer. We're really just asking people to be responsible and respectful. It's about protecting the people around us. So if you are unable to wear a mask, reach out to your local business and see if they have an alternative way for you to access their services.
Okay. I'm going to go back to the 2 doctors now and ask the next question about budgets. How will the budget for the upcoming year account for safety precautions like updated air ventilation systems, PPE for staff and students, and cleaning materials? Will all districts be upgrading their air quality systems? How does that work?
Go for it, Jeff.
Okay, well, I guess I'll handle the air quality system piece. You know, even up at BOCES, we've had concerns about that, of what we can do with our ventilation systems. And one thing we need to be cautious of is if you get too extreme on the kind of filtering you do, you're going to harm your ability to ventilate an area. So we need to keep those places safe. We don't want to cause additional problem by doing too much retrofitting. So we're leaving that to the experts and architects and engineers to look at what we have and also look for the best guidance as far as ventilation. We have not so far been allowing folks to be in places that weren't ventilated, and we're working on remedying those situations and maybe assigning one individual there where there's no interaction with other people in an area. So there's just that one person given access. So that's one solution that can be made. We have monstrous concerns about finances supporting our reopening. The best thing people can do is to right now advocate for the state and our federal government to get the support for school districts for reopening so we can afford the personal protective equipment for all of our faculty and staff and to fill the gaps with our students who haven't been able to access what they need in order to be able to come to school over a long period of time. This isn't about opening up and keeping it open for the first week. You can't have the same mass for an entire semester. We're going to need a consistent funding stream to be able to ensure that we can keep all of our spaces clean and safe and all of our people protected. So that is a big issue because our schools were level funded this year. They're level funded partially with some backfilling from some federal funding that is yet to arrive, and we still have to apply for that. So that is a legit issue of how we're going to afford to do all the things that we'd like to do without having to do layoffs of staff that we so desperately need to do the reopening.
Yeah, I wish to echo and underscore Dr. Madison. Yes, our Board of Education and leadership team has been very thoughtful over years now. We've planned for situations like this. We're using reserve funds, the contingency monies. We do a year-round budgeting process. So we are prepared for this year. We're using our rainy day funds because it's raining, but we need a sustainable funding source, and we need that soon. Or, you know, we didn't lay off folks this year. We paid our essential employees double pay. So we're in a good spot right now, and we're continuing to pay our educators their contractual raises. All good things, but we're going to need some additional support in the coming year if we wish to be sustained.
And Dr. Brown, I have a question exactly about ventilation within your school buildings. Is that something you've looked at, and how will that be addressed?
Yeah, we like Dr. Madison, we've been looking at it, and we've been looking at it over the last decade. Quite frankly, we've had several capital improvement projects, energy performance projects where we've upgraded our HVAC systems and improved our ventilation. But you know, it's an ongoing process. When you have 1 million square feet, it's never ending. So we're looking at that this summer even more so.
Right, thank you.
Mm-hmm.
Dr. Madison, you mentioned triggers, so 5% infection rate or below to reopen, the 9% triggers closure. Is that consistent across all school districts in the region? Are there different triggers? Can you just explain that a little bit more?
Yeah, that's the regional metrics set by the state. And so what'll happen is, just like in the first week of August, the governor will be looking at all of our metrics for, like, say, the southern tier, which is where we are. If it's below the 5%, we expect him to say, go with your plan for in-person instruction. Just as we expect, if it gets to the third week of September and we break the 9%, he will be making that call. It'll be a regional call, and those calls come directly from the executive. So that's not going to be a local decision. Those are metrics we're given. We can track it, obviously, and see how we're doing, but that won't be our local decision.
All right, thank you. More on that, the plans being developed by the districts, will they include contingency planning? So if a school needs to shut down due to a positive case, will classes then be designed to limit the close contact concern? And what would happen then? Is there a way to shift the instruction at that point?
Yeah, that's the hope. You know, on March 13th, we, across our community and across the country, were ill prepared to just flip a switch and go to a virtual environment. It took us 2 centuries to develop the model that we have, and people were expecting us to change that model over a weekend. So we've been developing the capacity to do that since March 13th and this summer. But again, people are still at home with their families. We have yet to be back with our folks to do great professional development in person, which is needed. to flip that switch and transition seamlessly to a virtual experience from the in-person one. So we're going to be better, but I'm going to be asking for patience from folks as we likely transition back and forth in the coming year or years, with hopes that we'll get better and better each time.
On that, and I think both Dr. Madison and Dr. Brown, you could speak a little to this. Have there been trainings or support for your instructors on how to manage that as they switch into this virtual world with also in-class instruction? What supports have been provided to them?
Dr. Madison, want to go first?
Sure. So we have gotten access real early and often to some of the best professional development that we could do online with folks. Lots of meetings online. Zoom interactions, obviously this spring became pretty important, and getting people access. We have technology integration specialists, and they also have them down, I know, Ithaca City. I know Lavelle will want to speak to this, that have worked closely with our faculty on how to put together a Google Classroom or a classroom on Schoology. And, you know, folks have embraced it. It's pretty remarkable how far we have come. But that was when we knew there was a finite amount of time we were going to have to do that. Now, when you're thinking about how much content you may have to build to support a classroom for extended periods of time, we've got to go deeper and build a sustainable model that can flex the in-person and the online.
Yeah, and I would add, we've had to focus this summer's professional development on how to educate in the digital environment, which all of us need support with. But also at the same time, while we're dealing with the health pandemic, we're also dealing with a social justice pandemic. How to develop this kind of content and curriculum and approaches to teaching and learning in a way that's anti-racist. So we're asking our folks and educators to evolve in many ways over the past couple of months and going forward, because our young people are going to be demanding something different and new, not just how to do this well in the digital environment, but how do you do this in a way that educates, engages, and empowers me as a learner in 2020. So the work of an educator is getting harder and harder every day, but more important every day as well.
Thank you, Dr. Brown. Mike, I'm going to shift over to you as we have a question about the census. So as you mentioned, a lot of the reason that some of our count may be undercounted at this point is our student population from the higher eds. In what ways is the county coordinating with the colleges to ensure that we have a complete count?
Well, we're working with all three colleges, at Cornell University and IC and Tompkins Cortland Community College. You have to remember there are on-campus students and there are off-campus living students. The ones that are on campus, there are group quarters counting that we can probably get a pretty good count of. The ones that live off campus are the more difficult ones to count, particularly now with COVID and those students having gone home from their apartments early this year before census count day on the 1st. We've been concerned that some of them may be being counted at home, you know, if they live in another state or another locality or another county. However, the census says that those students should be counted where they are at school at the time. So even if those students have been miscounted in another county or another locality, they can still go back online and put in the correct address in Tompkins County. Census has the ability to see duplicate filings and correct for that so that we get them counted where they should be. We're working with, particularly in the College Town area where there are, has traditionally been undercounted, and we have great help from our two census specialists, Mike Kaplinka-Lair and Jennifer Carius, as well as representatives from the colleges. In College Town, for example, going to talk to the landlords in some of the high-rise apartment buildings, for example, how can we make contact with those students? So we're also beginning an advertising campaign. And as students come back, we hope that we can follow up with individual census workers that will be going from house to house where they haven't got people counted yet. And all of those things will be coming together to work. It's a struggle, but we're doing our very best because we know how much it counts.
Right. All right. I'm going to go back to Frank on some community behaviors. And how should community members report unsafe behavior? What behaviors are most risky, and what would be most useful to report?
Yeah, it's a really good question. I think, you know, the business mask wearing is kind of our focus right now because it is one of the more higher risk locations. Certainly, they can report to us about large gatherings where it doesn't appear that social distancing or mask wearing is being adhered to. It is challenging, and I know there are folks in our community that want us to do a lot more around enforcement, and it is really challenging because we're not designed to be that type of agency. Law enforcement, quite frankly, has other things to be attending to, and so we're trying to be mindful of how we bring them into these situations. So respectful conversations are always a good way to go. But letting the health department know if something is going on is a good alternative as well. And we'll review all of those and do as much as we can related to enforcement.
All right. Here's another question about schools. A parent would like to know what will happen with choir classes at the high school. Since COVID virus transmission is by aerosol and droplets, will choir and other classes like that be canceled? And if students have already registered, how will that be done?
Yeah, I think this, we have a world-class program, and we intend for it to continue to be world-class at a distance. The guidance that we've received from the state, while young people in other situations is 6 feet in a music class or a vocal music class or any other type of music class is 12 feet. So we're planning for larger spaces for those classes, but for those classes to continue to run and it continue along with the instruction that's been so good for us all this time.
All right. More on the class sizes. There's a lot of talk about breaking up students at both K through 12 and universities into cohorts. What does that mean, and what does that look like? Is that a proven method of keeping people safe?
So I guess I'll start with that one. I wouldn't say it's a proven method for keeping people safe, since no one's ever really done it before in a pandemic. I will say that we do know that isolating people away from high interaction activities and the density issue helps prevent the spread of COVID. So it lends itself, the cohort model does lend itself to believe it would be a safer situation. For example, if you have some late elementary students who ordinarily get some direct instruction for a couple periods with a homeroom teacher, and then maybe they travel around the school getting a math specialist or an English specialist, and then they come back to their cohort. In a cohort model, the students stay, the adults come to deliver those services inside of the classroom. So there's other ways of doing cohort models. For example, doing in-person virtual instruction. What that means is the entire course is still an online course, but you're in person at your school, and you have a room you report to that's your cohort, your classroom, and you may go out for maybe some special areas, but for your instruction, you're there, you're working on your courses, and the teachers would come to you to give you some additional one-on-one direct instruction to make sure that you're getting the activities down. And it's much safer than having a lot of students in the hallways and community areas. So it would lend itself to be a safer model.
Well said. Ditto.
There's also discussion about the K through 12 students. Will there be different ways to bring back different age groups? Is there different strategies around that?
Yes, there are. We've explored those strategies, but I will tell you our intent right now is to bring all young people back, pre-K through 12. I've heard conversations around the country, folks are thinking about just bringing back elementary and having elementary students go into middle school and high schools. We've thought about that, we've looked at that, but again, our initial intent is to bring everyone back. pre-K through 12.
And Frank, if numbers were to spike as we bring back both college students and other students, how would the county manage that? What would that look like?
Similar to how we're managing an increase in numbers now, albeit small. We have a team of nurses that do our our case investigations and contact tracing, and we've been doing that throughout this pandemic as well as long before that with other communicable diseases. So we do feel like we're positioned to be able to respond. We have agreements with some of the higher ed institutions and their health centers to support us in those efforts, as well as we have the state contact tracing capabilities that have been built over the last few weeks to lean on as well. So I think we're prepared to deal with the potential increase. Really, what we're most interested in for our community is that as we do come back into more active life with both higher ed and K through 12, that we're following the guidance, the wearing masks, keeping 6 foot of separation. I think it was Dr. Brown that mentioned they can control what happens in the schools pretty closely, but we have little or no control about what people do, outside when they're shopping or going about their lives outside of education. And my apologies, my lights go off because I'm not moving enough. So I think we're prepared to deal with it, and we're obviously monitoring the situation. And as we have throughout all of this, it evolves almost on a daily basis, and we're making the best decisions that we can based off of the information we have at the time.
All right, thank you, Frank. I'm actually going to turn the questions over to Dominic Recchio, who's going to join us. He's our communications director, and he's going to continue asking the questions as I step out for another call. So thank you all, and I look forward to seeing you soon.
Great, thank you, Amy. The next question is also on the colleges. So how will college students be encouraged to quarantine when they return if they're sick? And then are there plans to manage and enforce that both on and off campus?
Yeah, so there's been several town halls in the last few days with our higher ed institutions, talking through some of these details. There is planning that still has to be completed around quarantining of folks traveling from the high infection states to understand how we're going to address all of that. But as far as isolating of sick individuals, each of the higher ed institutions has a plan and locations for doing that, and the health department would be coordinating with them to make sure that is all done efficiently and effectively.
Great, thanks. How about off-campus housing for students? What's the authority or enforcement if there are parties or non-adherence to the guidance? This is a question that we get a lot at the county and through the health department.
Yeah, we're working with our higher ed partners, with our municipal partners, with our law enforcement partners to try to make sure that we all are in coordination to deal with those issues. I know higher ed has plans around student behaviors and what they might do to help enforce those. Obviously off campus, it's a bit more difficult for them, but they are certainly interested and partners as we try to develop plans for addressing those issues. What I would emphasize is that throughout this whole event, we have been trying to use an education approach and educating people about why we need behavior change, and we've been fairly successful. And I know with a large student population that might present different challenges, but that's the approach that we're going to start with. And I believe we're going to be surprised that our students understand the situation and want to be part of the solutions here and are going to help us make sure that we have compliance with guidance and regulations.
Yeah, just to build on that quickly, we got some questions acknowledging that Cornell's concerned about the safety of students in the community, but how can permanent residents feel safe going to places like Wegmans when they return, or other community spaces that have a frequent participation by the public?
Sure, I think guidance has evolved for those type of businesses, including as recently as this week where the mask mandate became stronger. It really is about that personal responsibility and looking out for your own personal space. What we're asking you to do, to stay 6 feet away from folks, wear a mask, try to stay in low density numbers. So if you go to an environment that any one of those things seems not sufficient for your concern, you can remove yourself from those situations in almost every instance. And so, yes, we're not going to be perfect. We all understand that. But if each of us takes responsibility to say, I'm going to do everything I can to follow the guidance, and if I see a situation where I don't think guidance is being adhered to, I'm not going to put myself at risk and enter that situation.
Great, thanks. I'm going to ask a couple more questions about the schools that have come in. Do K-12 schools have to test students under the new guidance by the state?
There won't be a requirement to test them before they begin, but there's going to be screening procedures that we all have to put in place to ensure that their temperature has been taken, that parents are reviewing with their child and can answer the questions appropriately about whether they've been in any high-risk areas or had any high-risk activities. The screening then would lead to the testing. And that's basically how the testing would occur. There wouldn't be a massive screening to allow someone in, but they'd have to answer the screening questions appropriately before they're allowed to come back if they say that they've engaged or been around someone who has been exposed to COVID or been in one of those hotspots. That would then trigger the testing.
Thanks. And another question that's also in relation to schools we've gotten a few times. If a vaccine becomes available, would all youth and school staff be required to receive it?
Oh boy, I want Amy back, Dominic. Your questions are too hard.
Hard-hitting questions from the public.
No, I like it. And I'll echo Frank. We're taking an education approach on that as well. Would this vaccine be mandated or part of law? I think our community is well aware of the struggles we've had with implementing the current laws around vaccination. So it's a bit soon to answer that question without having all the facts, but we will continue to educate about the benefits of vaccines, which we currently have young people receiving each and every day in our schools.
Thanks.
And just to follow up and give the doctors a little bit of breather on that, that will be a directive from the state, as are the current vaccine laws. School districts are just the responsible party for ensuring they're not allowing non-vaccinated individuals into school inappropriately. So any mandate or requirements around vaccines would be established by the New York State Department of Health.
Great. Thank you. Speaking of a state guidance, Frank, the governor announced last week that COVID testing has been expanded to all New Yorkers. How do people get tested? You know, this has changed over time. Who's been getting tested? You know, why are folks getting turned away at the sampling site? Some folks have been posting online or had some of those questions. And I think it asks as well, who pays for that testing as well?
Yeah, it's a really good question. And that last part of it is kind of what's driving things now. Yes, the governor did say all New Yorkers can get tested, but the caveat to that is at a New York State run sampling site. So the closest to us are in Broome County and Onondaga County. Cuyahoga Health Systems has been an amazing partner in setting up testing for us here in the county, and likely are a big reason why we were able to control the disease to the levels that we have. But they've been doing that with no assurance on who is going to pay for that testing. And with recent direction from the federal government to insurance companies that only medically necessary testing is required to be paid by insurance, there's no reimbursement method for anything beyond medically necessary, which would be those individuals that are sick, are in close contact, or related to preoperatory needs. So all of the other testing, there is not a funding source for, and Cuyahoga Health Systems has done an amazing thing by doing all the testing that they have, but they can't do it forever without a reimbursement mechanism. So we are advocating with the state to try to figure that solution out here locally. But in the interim, the answer for all New Yorkers, if they are not eligible at Cuyahoga Health Systems, is to travel to Broome or Onondaga.
Thanks, Frank. We have a couple more questions for the schools that have just come in. Someone is referencing the fact that keeping students engaged in online classes is a challenge and was throughout the spring semester. And is that something that the school districts are actively addressing in order to engage students more thoroughly via online mediums?
Yes, I mentioned it earlier. Well, keeping students engaged in any medium is always a challenge, and that's a focus of our professional development efforts. Again, we March 13th was a big day for us. We flipped the switch and stopped the model that we had spent all of our time preparing for to do something completely different. So yes, we again continue to ask folks as patients. We did well with it, but we can do much, much better. And we have the most talented educators in our country who are rising to the challenge since then and over the summer and into the coming years as we will get better and better. But yes, I admit engaging on people, Generation Z is difficult enough as it is. Doing that in a digital environment, which they are able to navigate well, but navigate well and also learn with is a challenge for them even. So we're even pushing the boundaries for young people who are with these tools all day, but now having to use them to learn is a bit of a shift for the learners as well.
Thank you, Dr. Brown. Frank, I have a question for you. Are the regional control rooms still meeting with New York State? And when the colleges open and other employers in the area start to open, including our school districts, there'll be more employees coming here from other southern tier counties. How is that situation being managed and looked at?
Yes, the control rooms do still have mostly daily calls to gauge how things are going in the region and really get additional guidance from the state about new industries or businesses reopening and how we're applying that in an effort to try to do it uniformly across our region. And certainly we'll be monitoring the disease numbers moving forward as we continue to reopen and bring new businesses and organizations back to business.
Great, thank you. A question on the nature of the disease. With so many people contracting the virus across the US, as we've seen the number increase, is herd immunity more likely? Is there more information on that, Frank?
We still don't have certainty that previous exposure creates any type of protection. You know, past knowledge of coronaviruses tells us that there should be some, at least minimal protective factor for those that have been exposed previously. We just don't know for certain. Obviously, as more people are exposed, we'll have the opportunity to gather data about whether or not they can potentially contract the disease again. So it takes time to understand that herd immunity. The best and most effective way to gather herd immunity is through immunization. And so we are still hopeful that a vaccine will be available soon.
Thank you. Will college students be tested on campus or through the drive-through site that the hospital is currently operating? Will there be other public sites that open in the future?
So the higher ed testing in the higher ed plans is being conducted through the higher ed institutions. So most of that testing will happen on campus in some form or fashion. There is likely to be some students, faculty and staff that do still go through the drive-through, but the main location will be related to campus. As far as who's paying, it goes back to that situation I was talking about before. The higher ed institutions will have to pay for any testing that they design and require as part of their reopening plans. As far as additional sites in Tompkins County, until we get another a confirmed reimbursement source beyond where we currently are, we're just trying to maintain what we currently have. So we would love to have more opportunities. We get that the drive-through at the mall isn't perfect for everyone, but we're doing the best we can to make it as available as possible.
Thank you. I have one more question for you before a few more about schools. The question is, what does a 14-day quarantine look like after a travel, someone travels back from one of the states on a travel advisory? Can people go to work? What about kids that have daycare needs or other things? People are concerned about that quarantine necessary after traveling back.
Yeah, the quarantines are just that. It's staying home and not exposing others. If, you know, the whole family did the travel together, certainly they're quarantining together, but they should not be going to the grocery store or other places to potentially expose others. There are some exemptions for essential workers, but those are generally in place for those essential workers that absolutely have to work, like healthcare, law enforcement, and perhaps some related to commerce. So unless you absolutely have to work, the quarantine requires you to stay home.
Great, thank you, Frank. This is a question that I think we can go around to everyone to have them answer, is how do you see the pandemic affecting the lives of students, staff, and parents in the fall semester? You know, what things are people going to have to consider changing, and how should folks consider going about that? We'll start with Mike Lane, and then I'll walk us through around the horn here.
Well, it's a big question. I would think that the first thing that parents have to decide is whether or not their child is going to be safe in school. And so I think it's up to us as leaders of the community, leaders of the schools we have here in front of us, to convince parents and the children that there will be a level of safety when they resume whatever various guidance is in place, and how best to ensure that when these precious young people are entrusted to our schools, that they're sent home as safe as possible.
Thank you. Dr. Madison?
Yes, I would say just prepare yourself for being a great neighbor, a great family member, and be prepared for uncertainty. There's still a lot of things that evolve during this time when we come back to school. And you may have a neighbor who needs some support with their kids if they can't say they have the issue where they're quarantined, the rest of their family is not. We need to adjust by supporting each other. I feel very fortunate to be a Tompkins County resident. The way people have pulled together and supported each other, it's going to be even more defined in keeping really good communication between families in their schools, making good decisions, reading the stuff that comes to your home, responding to surveys that come so that districts can make good decisions, and just being in constant communication. And like I said, there's going to be people who are going to need assistance with their childcare situations, including our faculty and staff. And we just need to step up and be the person who stands in the gap for those folks.
Thank you. Dr. Brown?
Yeah, I would add to what my great colleagues just shared. We are in the early pages of a very, very long story. And what I hope that this pandemic has done is given us an opportunity, and we just completed a survey with our community, and folks outright said, we want something different when we re-enter our buildings. And I see that as a challenge, and I'm fueled by that challenge. We have an opportunity to address the inequities that have plagued our schools for centuries now. This pandemic highlighted a lot for us. The inequities that exist when it comes to technology usage and availability, the inequities that are connected to meals, housing, you name it. It's highlighted all those inequities that exist in our community that folks didn't talk much about until March 13th. We have an opportunity as a community, as a school district, to address those things in new and different ways, to provide choice, voice, and choice for our families. We have an opportunity to build capacity to say to a family, when your school experience can be completely in person, it can also be completely virtual. And you know what? We can also offer something that's more hybrid. Why haven't we done that before? And because we have not, we have produced inequities. We've been an oppressive system, and our system has not worked for every young person ever. We have an opportunity to rethink it and reimagine it and do something that, with hopes, will provide what everyone needs and what everyone wants in an equitable way. So I'm super excited. And we're just starting. And I hope the next 10 years of my time here in Ithaca will be us looking at these things that, quite frankly, we haven't talked much about until now.
Thank you, Dr. Brown. Frank?
Thanks, Dominic. It's a great question. And I'd start off by saying it's okay to be nervous. It's okay to have concerns. My daughter is scheduled to start kindergarten this year. So on top of the nerves about handing her over to what I know are extremely confident professionals, in her school district, you layer COVID-19 on top of that. And my wife and I are having similar conversations that I imagine are happening in homes all around our county, state, and country right now. What I can offer to our community is, my commitment that as we're making decisions and helping the districts navigate through this, I'm not only doing it as a public health director, I'm doing it as a parent that's going to be sending a child into our local school system. And so I think as folks are watching this evolve on the news every day at night, it might seem like these faceless government people, but we're not. We're all community members. We have families that are part of these communities and will be participating in the school systems. And so we care just as much about it as everyone else, and are going to do our best to make sure that we are doing right by our young people and making sure they're safe.
Thank you, Frank. Yeah, thank you all for really thoughtful answers to that question. We had one more specific question that came through, and then we'll wrap up with general thoughts. Are there any discussions about using non-traditional classroom spaces, including more outdoor space that could improve natural ventilation in a cost-effective way?
Yes.
Yeah. I'll give one quick example that I just learned today. The best ideas come from the people who have to execute the plan, right? And so we have some people who have been doing a lot of talking, and we have a common area that's outdoors in our Smith school, and they're already arranging to put a tent out there so we can have an additional classroom that's outdoors in the fall while the weather stays with us. So there's ways, and that can ensure some additional social distancing, an additional classroom for a short period of time. And I'm sure districts all over the state and schools in our region are thinking of creative little things just to break it up a little bit to ensure that there's some great ventilated areas and a different experience for some of our students.
Really good example. Thank you for sharing. So we've made it through all of the questions that have been submitted. Thank you for your answers. This will be archived online in the future on the county's YouTube page, and we host these every other week, and we'll do them on special topics like education as they come up. I wanted to go around once again to see if there were any closing thoughts or anything that we felt was important to make sure that the community was reminded of. And I'll start with you, Legislator Mike Lane.
Well, thanks again, Dominic, and thanks to our guests today for being with us and the great comments. I guess it's up to the folks that are listening to make all of this happen. We need their confidence, we need their advice, we need their suggestions, we need their questions, and we need them to spread the word about the guidance on COVID, the guidance on school reopenings, and certainly the census information that I spoke about, which is part of the financial underpinning of how we're going to be able to go forward and afford the things we need to do. So we look to them for help, and I know our community will come together and be an example for others to follow.
Thank you, Mike. Frank, do you have anything else to add?
Sure, just to add to what Mike just said, and I think Dr. Brown mentioned it earlier, it's up to each of us what the future is going to hold, whether it's higher ed, K through 12, or just the community in general. Our behaviors, the things we do today, are going to impact what we're able to do in the future. And Tompkins County, the residents here have done an amazing job to date in helping us navigate through this. And I'm confident that we'll do it well together as we tackle these new challenges that are ahead of us.
Thank you. Dr. Madison?
Sure. Thank you, Dom. And thank you for the opportunity today for us to share as much information as we have been able to share. It's an easy way to get all of this information out. But I guess I'd end with just please have a lot of understanding and flexibility. We've never been charged with reopening schools in a global pandemic before. Not everything that we try to put together is going to work on day one. We're going to need some patience and flexibility and communication, and it may have to shift 2 weeks into the school year. And understand that we're not trying to disrupt anybody's life. We're trying to create the safest situation we possibly can to educate your children so that they don't we don't have a lost generation. This can have long-term impacts if we don't get this right. And again, I'm grateful for where I live. I'm grateful for this community, but it is a global pandemic and we're not in it alone. And there's people we can advocate to for assistance. And I just want to remind you that if we can get additional support through the federal government, through our state to support our schools to ensure we're able to sustain whatever model we put in place, that would be really helpful to us. And that's something that your voice really matters in.
Thank you. And Dr. Brown?
Yes, no, thank you for the opportunity. And yes, people probably can predict what I'm going to say. I'm asking for folks to love. I know our governor has said that almost every day for the last 111 days, but here in our community, we've defined what love is. And you've heard it on this call, that trust, that patience, that forgiveness, that kindness, and most importantly, from my perspective right now, is that commitment. We are boldly committing to transforming a community and a school district. We are boldly committing to being an anti-racist school district. We're boldly committing to offering voice and choice to families. That's going to require a lot of love. And what I've learned is love is not a love fest. It's going to be hard, and we're going to be challenged in ways we haven't been challenged before. But we will keep coming back to that's how love has been defined here. And I'm looking forward to loving what my neighbors and community members for a while. Thank you.
Great. Thank you, Dr. Brown. And thank you to all of our guests for joining us today and providing clear information to the community. Thanks to everyone who submitted questions leading up to this and during the event. Tompkins County is committed to continuing to do these live streams on our YouTube channel. We'll be posting those out to the community. We'll probably do another one of these in 2 weeks' time. So we'll share that information with the community moving forward. Thank you again for joining us, and tune in next time.